Welcome to This Explainer. Today we're doing something really fun. We're diving into a brilliantly simple framework from the StudyWithAmfeen medical curriculum to unpack the human body. Specifically, we're looking at the classification of bones. Imagine you're opening a brand new, clean white notebook, you've got your blue pen out, and we're writing down our very first heading together. We're going to take all that complex textbook anatomy and break it down into incredibly clear, easy concepts.
But right before we jump into the heavy details, I've got a quick question for you. Can you guess exactly how many distinct bone shapes exist in your entire body? Just take a second and think about it. Got a number in your head? Okay, hold on to it. We'll see if you're right in just a minute. All right, so here's our path for today. We'll start by meeting your skeletal system. Then we'll break down those bone shapes, look at some really relatable daily life examples, cover a few clinical tips, and then wrap the whole thing up with a quick review and a quiz. Okay, let's dive right into this.
Section 1. Meet your skeletal system.
Now, our key objectives today are pretty straightforward. If you were taking notes right now, these are the concepts you'd absolutely want to underline in red ink because they are pure exam essentials. We're going to learn the bone shapes, anchor them with easy daily life examples, and master a few clinical exam tips that really highlight why all of this actually matters in the real world.
Moving right along to Section 2, the 5 bone shapes.
So if you guessed the number 5 earlier, you hit the nail right on the head. Out of the hundreds of bones spanning from your head all the way down to your toes, you really only need to remember 5 distinct shape categories. That's it, just 5. Let's look at the very first one.
First up, we have long bones. Now, the definition here is super simple. They are literally just bones that are longer than they are wide. That's the absolute key word to focus on here, longer. If its length is greater than its width, boom, it fits right into this category.
A perfect daily life example of this is the femur, your thigh bone. Think of a house that needs really strong pillars to hold up a heavy roof. Well, your long bones act exactly like those structural pillars, basically holding up the massive weight of your entire body. Next up, we have short bones and flat bones. So short bones are cube-like. They're almost like little boxes. Think of the bones in your wrist, which are designed to allow for really fine, precise little movements. Flat bones, on the other hand, well, they're thin and flat, just like your skull. They essentially act as these incredibly strong protective shields for your soft, vital organs. Okay, the fourth category is irregular bones. These are the ones with really complex shapes that just do not fit into any of the other categories we talked about. Your spine or your vertebrae is actually the perfect mental picture for this. It's a highly unique structure, right? It has all these various bumps and outcroppings pointing in a bunch of different directions.
And that brings us to our fifth and final shape, the sesamoid bone. I love these. Think of these as secret little bones hidden away right inside your tendons. They're small and round, actually a lot like a sesame seed, which is where they get their name, and they function to essentially protect the tendon from stress and daily wear and tear.
All right, Section 3, Daily Life Bone Examples.
Now, to really lock these shapes into your brain, the StudyWithAmfeen curriculum uses a clever memory trick system. This is where we mentally bring out the green pen to trigger fast recall during an exam. So for long bones, like the femur, just visualize a tall pillar. For short bones, like the carpals in your wrist, picture ice cubes rattling in a glass. And for a flat bone, like the skull, think of a flat helmet you'd wear while riding a scooter. Connecting these biological structures to everyday objects makes them almost impossible to forget, right?
Moving to Section 4, Clinical Tips and Tricks.
So here's a crucial clinical tip. If a long bone breaks, movement becomes difficult because leverage is lost. To put that really simply, your long bones basically operate as levers, kind of like the handles on a simple machine. If that lever snaps, the muscle suddenly has nothing to pull against, and the machinery of your body just stalls out. It's a huge disruption.
And now, Section 5, Quick Review and Quiz. Let's see how much you've absorbed. Let's do a rapid-fire revision of the 5 shapes. We've got long, short, flat, irregular, and sesamoid. That right there is the absolute core foundation of your skeletal classification.
All right, it is quiz time. The bones in your wrist are examples of which shape? Try to think back to that green pen memory trick with the everyday objects. Got your answer ready?
The answer is short bones. If you pictured those little ice cubes, you absolutely nailed it. Awesome job.
Okay, let's try just one more. The skull, which protects your brain, is an example of which shape? Remember the scooter analogy? What do you think?
Flat bones. See, this shows exactly how effective those simple memory associations can be.
You picture the protective helmet, and suddenly the anatomy just makes perfect sense.
Before we wrap up this explainer, I want to leave you with a bit of homework. Consider this. What shape classification is your kneecap or patella? Well, actually, I'll just tell you. It's a sesamoid bone. It's one of those secret bones embedded directly into the tendon to handle the immense mechanical stress you put on it every time you walk. It really makes you realize that our skeletal system isn't just some random collection of bones. It's this highly evolved structural engineering marvel, perfectly adapted for human movement. So next time you take a step, just ask yourself, how many levers, shields, and hidden physiological secrets are at work right now just to keep you moving? If you found this explainer helpful, please like, share, and subscribe to Study with AmFame. See you in the next anatomy lecture.